Hello everyone, we are Group 26. I am Lin Kexin and the other members of our group are Li Tingting, Jiang Rui, Lu Xinyu, and Li Mengjie. The topic we choose for our research is a study on the spread of social media rumors during the COVID pandemic. Now I will explain why we choose it. First of all, this topic is highly relevant to society. During the COVID pandemic, social media became a key channel for information sharing. However, the rapid spread of rumors caused panic, misinformation, and even threatened public health and social stability. Therefore, studying this issue is very urgent. Secondly, from an academic point of view, the study of rumor dissemination involves many fields such as communication, psychology, public health, and so on, and it is closely related to science communication. In the context of the COVID pandemic, analyzing the characteristics and the effects of social media rumors not only contributes to the theoretical research but also helps develop strategies for future crises. Additionally, this research has important practical value. By analyzing the law of rumor dissemination, it can help the government optimize the information release mechanism, guide media platforms to improve their algorithms, strengthen rumor governance, and also enhance the public's ability to discern information. Moreover, social media platforms provide rich data resources. Using big data analysis and natural language processing, we can study the spreading paths, speed, and audience behavior quantitatively, making this research highly feasible. Finally, this topic has significant implications for improving crisis communication management. It applies not only to the COVID-19 pandemic, but also to other public health emergencies. At the same time, it aligns with our academic interests and research goals. This topic combines theoretical importance, practical value, and feasibility, making it worth depth exploration. Next, our group members will provide more details. Thank you.
This part I'm going to talk about a vital issue during the COVID-19 pandemic, the spread of rumors on social media. In addition to concerns about the virus, we also saw an epidemic of infodemic, where both true and false information spread rapidly online. Social media platforms have become a viral source of information for people, but they also amplify misinformation, creating confusion and fear. Rumors on social media can have some pretty serious consequences. For example, they can make people hesitant to wear masks or get vaccinated, and also increase public anxiety and distrust of health experts. Studies have shown that social media algorithms prioritize engaging content, which means false information spreads faster than the truth. This makes it more hard for governments and organizations to share timely and accurate information. As science communication students, we choose this topic because understanding how rumors spread can help us fight with misinformation. Research has looked into why people believe and share false information, such as the influence of fear, trust, or social norms. Some studies also explore how to stop rumors, like using fact-checking or sharing corrections. Although these methods are not always effective, by studying these issues, we hope to find better ways to manage misinformation during future public health crises. This is not just about stopping rumors, it is about protecting public health and rebuilding trust in reliable information. That's all for my part.
My presentation focuses on the literature review. we selected 10 papers categorized into 4 themes: misinformation and rumor dynamics, behavioral responses and public health communication, social media analysis, and interventions and solutions for misinformation. I will organize the research gap within this theme. The first part contains 5 papers. The research focuses on misinformation and rumor dynamics. The study examines the spread, belief, and the consequences of misinformation during the COVID-19 pandemic. Key research gaps include cross-cultural researches, limited generalizability due to focus on specific national contexts, non-COVID-19 misinformation, lack of insight on misinformation during other health crises, long-term impact, insufficient exploration of lasting effect on public trust and behavior. The second part contains 2 papers. The research focus is behavioral responses and public health communication. This part focuses on how information influences public behavior and the role of communication strategies. Key gaps include behavioral changes over time, limited research on a long-term behavioral effect, role of emotion and psychological, underexplored emotions and collegial mediation of misinformation, effectiveness of communication strategies, lack of comparative analysis of different approaches. The third part contains 2 papers. The research focus is social media analysis. This study focuses on misinformation dynamic cross-platform. Key gaps include platform-specific dynamic, insufficient focus on smaller or emerging platforms, comparative analysis, limited cross-platform comparisons of content engagement and algorithms, users' behavior interaction, lack of research on how behavior like sharing amplify misinformation. The fourth part contains 1 paper. The research focus is interventions and solutions. This section explores strategies to combat misinformation. Key gaps include long-term effects, insufficient study of lasting impact of interventions like accuracy nudged, scalability, lack of testing interventions in real-world, large-scale scenarios, counter-strategies, limited research on correcting entrenched misinformation effectively. Thank you.
This research aims to address the following question: how did social media rumors during the COVID-19 pandemic influence public behaviors, and what measures can be adopted to mitigate their effects in future crises? Specifically, this study will explore the drivers of rumor propagation across major social media platforms, including the role of all themes, user behavior patterns, and cross-platform dissemination differences. Analyze the specific impacts of COVID-19 rumors on public behavior, such as vaccine hesitancy, non-compliance with public health guidelines, and erosion of trust in health policies. Assess the effectiveness of counter-misinformation strategies implemented during the pandemic, including fact-checking, content labeling, and information suppression. Assess the effectiveness of counter-misinformation strategies implemented during the pandemic, including fact-checking, content labeling, and information suppression. Investigate the psychological impacts of rumor dissemination, such as anxiety, panic, or decision-making challenge caused by misinformation. examine how conspiracy theories about the virus origin exacerbated societal tensions or failed racial bases, as well as their long-term effects on intergroup relations. Evaluate the coordination mechanisms between social media platforms and governments in managing rumor propagation, and process improved strategies for fostering effective cross-agency collaboration. Through a systematic analysis of the various disseminations outlined above, this study aims not only to fill the research gap regarding the spread of social media rumors and their societal impact during public health crises, but also to provide valuable recommendations for policymakers, social media platforms, and public health organizations. These recommendations will help them better manage information dissemination and mitigate the negative effects of rumor on public behavior and mental health in future crises. It's hoped that this research will offer theoretical support for more effective emergency information management and provide practical strategies for addressing the challenges of information spread during future global public health crises.